Your feet, the truth you do not know. That's the topic of the episode today for the episode 2 of Ask Giri, the Physio Show. I am Giri Srinivasan, registered physical therapist in Edmonton, Alberta, Canada. Why did we choose this topic? Why feet? Because feet is the most ignored body part within us. We don't care about it very much, even though that is our foundation and that is our wheels. But that's the most ignored part as well. Your feet is where your posture starts and ends. That is why we chose to talk about feet and give you some valuable information and some knowledge so that you know how to take care of your feet for your well-being. So now we're going to see a little bit of very brief anatomy of your feet. So in our body, we totally have about 206 bones. Do you know how many bones we have in our feet? Just give it a guess. Each foot has about 26 bones. So together in both feet, we have about 52 bones. That's 1/4 of the bones we have in our whole body. It's just in both of our feet. So we definitely need to pay some attention to them, isn't it? And we have about 33 joints and about 30 muscles in each foot. So that's a lot of structures in that feet actually, which is our foundation. And also don't forget all the soft tissues, all the collagens, right? The plantar fascia and all the ligaments which is supporting your arches of the foot and the marvelous bony architecture we have in our feet. And also the Achilles tendon, which is attaching, one of the biggest tendon, which is attaching in the back of the foot at the heel bone. That's one big tendon. And we have several other tendons on top of the foot and also the sides of the foot, acts as a sling mechanism as well. So you should remember those things, how many of structures we are talking about here in your feet. And the main important thing we have to understand is about the arches of the foot. So we have 3 arches in our foot. So we have 2 longitudinal arches, which is going from the front to back, and then we have 1 transverse arch from side to side. So these arches are there for a reason. What does it do, right? When you land or when you just step on, it absorbs, it kind of like this, it absorbs the force, and shock absorption is number 1 duty of that arches. Second, when it absorbs the shock, it also stores some energy in the architecture along with the soft tissues, which releases when you push off. So it helps you in push off like a spring-like action when you push off. So that's very important as well. And number 3 is it distributes your body weight and from the front to the back, from back to the front or the side to side on your foot. And also when you're stepping on some uneven objects and surfaces, it makes your feet or foot to be very malleable and flexible to wrap around that object to kind of not very rigid. It can make your foot rigid, at the same time it can make your foot very flexible as well when it needs to be. Those are the 4 important functions of your arch which you have to understand. So knowing the importance of the feet, the anatomy and the arches, now we're going to talk about how to take care of them. We're going to talk about in the category of protect, correct and develop as per my guru Gray Cook for functional movement. So we're going to see how we're going to protect the feet, how we're going to correct and how we're going to develop the feet. For protection, what are we going to do? First of all, how to protect your feet from the shoes. You might be going, are you crazy? Why are you saying this? Like, shoes are not harmful, but I would disagree with you guys to say what are the things our shoes are doing for you guys when you put your feet in your shoes all the time. Shoe is equal to cast, right? It's like a cage. Our feet are designed to be barefooted most of the time. They work very well and efficiently when they're barefooted. So you'll ask, what are the shoes doing to me? What are the shoes doing to you? A lot of things. When you put your feet inside the shoes for a long time, and because of the little bit of heel you have in your shoe, it always keep your back of the foot a little bit higher than the front. So that actually shortens your Achilles tendon, and it also weakens the Achilles tendon. And you don't have a lot of room to wiggle your toes around in the shoes. Most of the shoes has very narrow toe boxes, and that squishes your toes actually. And if you compare the picture of the shoe and your on your feet, bare feet, you will understand. The bare feet is nice and wide, the angle is like this, but your toe box will be like that in a kind of parabolic shape. So you can see how much your toes are squished in the front as well. Not only that, it changes the way your feet distributes the weight among that muscles and tendons and the joints and arches in your feet. It does a lot of not so good things to your feet. So we're going to compare. I'm going to grab a shoe. So a normal shoe. This is my actually a cricketing shoe. That's a Kookaburra brand from Australia. Anyway, I'm not selling the shoe here. So if you see the shoe here, you can see the heel, the amount of heel we have here, right? That always brings your foot normally a little bit higher compared to you compare this shoe with the barefoot, right? When you're barefoot, your foot is flat on the floor and with no up or down movements and good contact. But with here, your heel is going to be up a little bit. That shortens this. And then see, here we call this the last, and the last is always shaped a little bit curved, but your foot axis and the shoe axis is totally different. And in the front, what you see here, this is called toe spring, right? This gap here, this is about 20 degrees usually, the toe spring, right? They keep this so that it's easy for you to clear the ground in the shoes, because the shoe is not as good as your normal foot or naked foot, right? So in the naked foot, your toes does the job of clearing that push off and creating the toe spring action. But in the shoe, it is very rigid base. It cannot mimic the same action. That's why they have this toe spring, which is 20 degrees here, to kind of get that going like that. So the shoes are created for you to make you walk kind of in a more rocking fashion. But our normal barefoot walking is not rocking fashion. So that's not a very normal movement pattern when you walk. We are talking about comparing the shoes and the normal barefoot here. And also, do you know that inside the shoe, your feet, the temperature there, it can go about 120 degrees Fahrenheit? And also, what about the sensory feedback? You have about 100,000, 200,000 nerve endings in your feet. Are they being stimulated properly when you keep your feet all day in the shoes? No, they're not. They're better stimulated when you're barefooted. So you're also you're disconnecting your feet to your brain, not proper sensory feedback. So those are the things you have to think about when you're wearing shoes all day. And even I've noticed some of my patients are wearing slippers or flip-flops at home all the time, or on the socks all the time. I understand Canadian winter, you want to keep your feet warm, you wear socks, but you should not be wearing slippers and flip-flops all the time in the house also. And those things you have to think about as well. Next, we're going to talk about high heels. How high heels affects your total body and your feet. So before we talk about the high heels, we have to see how the normal foot rests on the floor nicely without any heels. So this is how it's supposed to be resting nicely here, and toes splayed out. Every toe should be formed kind of nice raise here, not too crowded in the front with the shoes, and then heel is sitting nicely down there. Imagine now if my model Anus is wearing 3 inches high heel. So that's about 3 inches. So this is how she's going to be all day with the high heels. See what are the things happening here. See how much it's elevated and how much force is transferred from the back of the foot to the front of the foot. 90% of our body weight on this side is in the front now. That's too much force going here, compressing that area way too much. And you also have a lot of nerves in between there, which can get compressed and giving you pain as well, and too much stress for that. And see these wrinkles here? See the Achilles tendon, how shortened it becomes. And the same thing happens to the calf. Look at the tone in the calf and in the Achilles tendon, right? So that's all shortened. When you do this, and also remember the knee, the body weight now put more in the front of the knee. 23% more stress goes through the front of the knee there, and you can get knee pain. And you can go up a little bit and see the hip, how she's kind of, hip is kind of forwarded there. The activation of the hip muscles are different, and the spine, everything changes because of this way. So that is why high heels is a big no-no. So we talked about protect, how to protect your feet from shoes and high heels. Now we have to talk about correct, right? What are the tools you need to do correction? How many of us very regularly inspect our feet? Basically, how many of us touch the feet to see how they are doing and feel them, right? That's the most ignored part of our body. So we should be able to inspect our feet regularly, touch them and play with them, move the toes, move the forefoot, move the midfoot, move the hindfoot, and see how they are doing. Is it sore? Just some tender, loving care for the feet is needed, definitely. So what are the tools you need to correct? The tools varied from so many things. Number one, physical tools. You basically need some physical tools to correct few things, like a lacrosse ball like this, and also a foam pad like this, and some other tools I'm going to show you later. You can have some small tools. Even some marbles from the dollar store would help you to put them on the carpet and pick them up using the toes, work all those small muscles in the foot. And I put a towel on the floor and try to pull the towel towards you. That's all small intrinsic muscle work for your small muscles of the foot as well, and your toe movements and mobility, because toes do not breathe very well and move very well inside those very narrow toe boxes in your shoes. They don't have a lot of room for that at all. So you can do that. Those are the physical tools. And knowledge is another tool as well. What is the feet is all about, what they do for you, how to protect them, that's the knowledge. And that's the whole point of this episode, to give you that knowledge, right? Next thing is the movement. Movement is a tool as well. You should know how I'm not moving, how I should be moving, and how I can encourage the various movements in my feet to be rigid and flexible and to absorb shock and use as a spring at the same time. Next, supplement. Supplements, what I mean by supplement is, for example, if you sit all day, your hip is not moving very well, so that will affect your feet, because your hip and feet are like twin brothers. They work together. The hip positions your feet takes care of your hips, right? So if you're not moving very well with your hips, doing some hip mobility exercises to supplement the function of your feet. So these are the tools you need to have. So physical tools, knowledge tools, movement tools, and supplement tools. To movement, you have to have this controlled articular movements, controlled articular repetitions we call it. We call it CARs. Controlled articular repetitions you need to have. That's a totally different topic. We'll discuss how to do CARs for different joints, to do the mobility exercises differently. So these are the tools I would like to discuss with you guys, which helps you to correct. Next, we're going to talk about develop. So we saw how to protect and how to correct. Now we're going to discuss how to develop your feet for a better function. So for that, my assistant here, Anurit, is going to help me how to do plantar reset and other exercises. Plantar means the bottom surface of your foot. So how to reset them, because they undergo a lot of stress. So we're going to use the lacrosse ball, and to do that, we're going to show how to do it. Okay, here you can see Anu has put the lacrosse ball underneath the foot here, and she's just rolling her foot nicely from front to back. She's working on her outer arch, which is your lateral arch right now. Just nice and gentle pressure as you tolerate. Then bring it to the middle. Work on the plantar fascia a little bit, which is coming from your heel to the tip of the toes, which acts very good spring-like action for your arches. Then she's moving on to the medial arch, which is the inside of the foot. She's working on it nicely. Then she's going to put her heel on the ground, and she's going to work on those transverse arches and also forefoot a little bit, nice and firm pressure. Then she's going to work on her midfoot a little bit, nice and firm pressure. About 10 to 20 repetitions. The ideal dosage would be this kind of things 2 times a day, at least 20 repetitions 2 times a day for 2 weeks. It gives you very good result to reset your plantar surface. And this is plantar reset. So we talked about the plantar reset. Now we're going to see what are the things you can do at home just on your carpet or on your backyard, just with barefoot and the floor. We're going to show you. So first of all, try to stand with your feet really close to each other with the narrow base, and see how you're balanced, how you're able to do that. First with the eyes open, then with the eyes closed, you can try and see how it is. Then you can go for tandem standing. Tandem standing is putting one foot in front of the other, heel to toe, right? And see how you can stand like this with your eyes open, then eyes closed. Again, caution, people who have poor balance, please don't try this on your own. Please have somebody stand by you, or you have to hold on to something to check this. Last thing we want is anybody falling at home. So this you have to check on this. This is also good work for your feet. And then in this position, you can try to reach for different directions. Tandem standing, reaching, we're going to see. You're going to make sure you stand like that with your feet in front of other one, and then reach different directions. In front of you on the right hand side, in front of you on the left hand side, and then about here on the right hand side, and try to reach a little bit higher and reach forward. Good. And see how your feet has to work to stabilize your balance and the center of gravity within that narrow base. So that is the whole idea. Next, on the floor, you can do going on your toes. This is a very important exercise for the people who sit all day for work as well. And then come down, stay there for about 10 seconds and come down. This really helps in some stress relief in the foot and also working your calf muscles. Also in some bringing the fluid back from your feet to your heart. Some venous return as well. It's a great exercise. Then you can go on your heels. A lot of people going on the heels is very hard. You have to be careful not falling backwards. So going on your heels will be challenging for a lot of people, and lifting your toes up. You can try that at home as well. Next, we're going to teach you a very important exercise and very nice exercise to work on your arches. A lot of people will have fallen arches or flat arches. How to develop or how to improve that medial arch. A simple exercise, stand with your feet shoulder width apart and then go for a shallow squat. Now here, try to keep your toes and all the toes grounded nicely. Then try to open your knees out, right? And see how that arch is lifting on the inner side of her foot. And go back again to the neutral position. Okay, we start from here, and then from there slowly she's going to take the knees away from each other. You can see how the inner part of the foot is lifting. Okay, that is kind of because you have a lot of myofascial slings coming from the hip, knee to the foot to elevate that arch. So it's a great exercise for the arch also. We talked about feet on ball exercises, feet on floor exercises. Now we're going to talk about feet on the foam. People can invest in a small foam like this. This is an AirX foam, which is about $75 in Amazon if you have to order. It's a great tool to work to improve the balance, stability, and also the sensitivity and the sensation also, right? Connecting your feet to your brain without your vision. That's very important as well. We can train on that. So first she's going to stand with a narrow base, very narrow base, feet together, on that with eyes open, and see how you're doing. And if you're very comfortable and easy with it, try to close your eyes on this position and see, you can see a little bit of increased sway there. That's very normal. Normally everybody can sway about to a certain degree. Postural sway is normal. If it is too much, then you know there is a problem you have to work on. Okay, next we're going to do a tandem stand, Anu, one foot in front of the other. And then with eyes open, hands by the side, see if you can maintain that balance. Yeah, she's pretty good in that, isn't it? Okay, now let's see, closing your eyes, how you're doing. And I can see her foot is dancing a little bit more, okay? And so that's a little hard for her. But for a lot of people, it is hard. Like you don't challenge yourself that much because we are just always informing your brain through our eyes about our feet. We have to shut down those eyes and see how your feet and the brain are communicating. That will be very fun to see and fun to watch and train. So that's next one. Then we did the same thing on the floor. We're going to do tandem reaching, right? We're going to tandem standing and then reaching in different directions. Yeah, and then challenge. There you go. Good. So these things you can do. And one more thing you can do on the foam is also single leg standing, right? Try to stand with the one leg up and try to bring your knee up for me. Yeah, single leg standing. And also we can do some range of motion exercise in single leg standing. Bringing the leg forward, bringing the leg backward, and then sideways. And we can try on the other leg. So these are the different exercises you can do for that as well. Good. So these are the various exercises you can do on the foam. So after the feet on the ball, feet on the floor, feet on the foam, now we're going to talk about feet on the beam. So what you see here is a 4 feet beam here. It's made up of maple, and you can also make it something from the steel pipe if you want to be at home, or if you know a carpenter, he can make a nice beam for you guys from wood, or if you find a nice symmetrical long branch of a tree or something, be creative, find something like this. You can do tons of exercises with this beams, foot beams we call it. So we're going to show you. First we're going to try to stand on it with one leg and see how one is balancing. And see how this works your foot, the stabilizing foot. It has to do a lot of hard work to stabilize Anu's body balance on that. Good job. You got balance. Then can you change the foot? No. And these are the things our foot's supposed to be doing when we're walking barefoot on different things. But we are only walking on the level surface. That's a problem. We're developing so much foot problems. Good job. So that's one thing we are doing. And the second one I want you to do now, stand on one leg. Then we'll see, it's called high knee holds. You're able to bring your other knee up and see if you can maintain that. Good job. Nice focus. I know it's not easy. I know that. Very good. Now try the other side. Good, good, good. See, count yourself, time yourself like, how much time you're going there and try to beat yourself in the timing. That's a challenge for you. Good job. That's very good actually. That's a high knee hold. Now we're going to show you the cake slice. Come on, Anu. Let's do the cake slice. Be on one leg there and then just let the foot go out, the other foot, and come back and then go and then come back. Try the other foot. It's not easy. It's hard to do. We always have good fun with this in the clinic every day among the staff. Very good. Thank you. So that's the cake slice. So we saw the standing in one leg. We saw the high knee holds. We saw the cake slice. Now we can show you guys a tandem stand on that. Try to stay one foot in front of each other. And then try to balance if you can stay there. That's a little more challenging, isn't it? Not bad. You're doing pretty good. Yeah, now switch legs. Very good. Tandem stand. Very nice. So that's your tandem stands. Next, I'm going to show you the ninja stands. Okay. So for ninja stands, we're going to go put the heel down. Just put the front of the foot on the top and then we're going to try to go forward. I'll let Anu do that. So we'll see how she's doing. Good. And then try to go and lift your heel off and make sure you keep your knees unlocked and all the joints unlocked. Don't lock your knees and the hips. Let it move the way it wants to go move. It's good for the reactive hip stability as well. Nice breathing. Oh, good. She's pretty good in the ninja stance. Okay, so that's your ninja stance. There are so many progressions from here. I'm not showing you everything, so I'm just showing you one thing about it. That there's a way we progress about all these things. Next, I'm going to show you a fencing stance on the beam. Anu, can we do a fencing stance on the beam? So we're going to put one foot in the front, facing that way, and the other foot, maybe one foot, the front foot is parallel to it, and the back foot is perpendicular to the beam. So that's called fencing stance. So see if she can maintain the fencing stance. You can loosen up your arms and try to balance. That's a kind of a fencing stance. And then we'll switch legs. And again, there is so much progression from this fencing stance too. And this is just to start with. So these are some of the ideas how to develop your feet for the various functions, what is supposed to do. So, hope that was helpful, how to develop the feet. Now, just going forward, what are the things you can do to give your feet that breathing room, right? Try to be barefoot as much as possible at home. When you play in the backyard, be barefooted. So, don't worry about anything. You're not causing any damage to the feet. Your feet are created for that, right? And also, don't forget to teach that to your kids also, the next generation. We need to develop them to have a very strong feet, agile feet, and rigid feet as it has to be, and flexible feet, and prevent so many feet problems, and also feet, knee, hip, ankle, back problems for our kids. So encourage them to be barefooted as well as much as possible. It is very good. And also enjoy yourself driving barefoot. Try sometimes how fun it is. You will enjoy it as well. And also as employers in certain job scenarios, not the heavy industrial type, some office job scenarios, we can encourage our employees to be barefooted too. It's kind of a barefoot policy also. That's all. When we hear first time, it looks very shocking. Are you kidding me? You want me to be barefoot at work? But there are so many organizations are changing into that model. And there is also a society for barefoot living. It's called barefooters.org. www.barefooters.org. Check it out. There's a whole society out there who does everything in barefoot. And there's barefoot hiking. And you will be wondering, oh, I'm spending $200 for hiking boot. You're asking me to do hiking in barefoot? You'll be surprised how many people love to hike barefoot. Right? Yeah, there's going to be small cuts and bruises here and there. And they're all acceptable risk. Okay, compared to your other ill effects of the shoes when you wear it all the time. And those are the things I want you guys to think about it. Hope this episode was helpful for you to give some insight about how feet supposed to be, what are the things we are doing to abuse them, and how to protect, correct, and develop our feet. Now we'll take some questions from the audience. We got few questions. We're going to, I think, answer 3 of those questions in this episode. So Anu is going to ask some of the questions we received from our audiences, and then we'll try to answer that to the best of our ability. Go ahead, Anu.
The first question is from Christina from Edmonton.
Okay.
She says that she has a flat foot and what is the best she can do to take care of it. And she is also wondering that if she needs to wear arch support in the shoes.
Okay. So arch support in the shoes for flat foot. Do I need to do that? That's a question there. So your arches, as I described in this episode, has the function of absorbing the shock when you land and load the energy and helps you like a spring when you take off or push off that foot. So arch has to go up and down for them to able to function properly because the design is like that. Imagine just a piston, right? A shock absorber in your car. It has a piston, it has a pressure build capacity, the tank is there. The piston has to go in and out to have that good action of the shock absorption. If you put a block of something to block that piston action, how is going to do the shock absorption? Same thing. When you support your arch with something like this, you're not letting the arch to do any of those functions. So having an arch support in the shoe for every step you take is not the right answer. Consult your healthcare practitioner, your physiotherapist to have a proper assessment of what are the other things you can do to improve your arch. And also flat foot's not that bad, like you can work with a lot of things to compensate for that as well. Plus to improve the arch also there is exercises, and there are something else also might be a cause. It can be a cause from your knee or the hips because your hip and feet are working together. So think other options as well. Don't immediately jump into the arch support. Arch support is not going to let your arches to do their function as it is. There are very few people need that arch support. Even though we sell orthotics in the clinic, it's very less. And our indication for orthotics is very minimal. Only very few people get that. Not every single one gets an orthotic. So that's why think twice before you get the arch support. Do you really need your arch to stop functioning as it's supposed to be, the piston action, or you can do some other options? Thank you.
So the next question is from George from Edmonton.
Great.
And he says that he has been having trouble with his plantar fascia every 3 months, and he wants to know what is best to take care of it.
Okay. So George from Edmonton wants to know about plantar fascia care. George, I'm not sure you watched the full episode. We talked about plantar reset in this episode. That's a good way to kind of work on the stress release on the plantar surface of the foot. Plus also, if you are the one which you wear the shoes all the time, and please spend some barefoot time. That will be the sometimes an opposite advice to somebody asking you to wear some heel cushion when you have plantar fasciitis. When you are in acute stage, you can do that, but when you retrain your foot, you need to work without the heel cushions. You need to retrain your plantar fascia. And consult a physiotherapist to take care of it in the acute stage to reduce inflammation and things like that. And also appreciate your plantar fascia is not, even though in the anatomical books you see that coming from the heel bone and going attaching in the toes, it's a continuum of a facial structures coming from the superficial back line, coming from the back of your, actually front of the forehead, goes back all the way to your spine, all the way down to your pelvis, to the back of the legs, back of the calf muscle, Achilles tendon, and comes into the plantar fascia. So it's a continuum of structure. Sometimes you can have problems somewhere up in the lower back, which can cause plantar fasciitis as well. So you got to look beyond the area where it's giving you pain, and also your physiotherapist will be assessing your hip as well for that. And those are the things you can do to take care of your plantar fascia. You don't have to have recurrent plantar fascia issues. That means you're not addressing the cause of the problem. You're just chasing the pain. You can never win when you chase the pain.
So the last question is from Tina from Red Deer.
Okay.
She says that she started having pain this summer while wearing flip-flops.
Okay.
And she says that at work, she is wearing 2 inches of heel every day.
Okay.
So she wants to know what she can do to take care of it.
Sure. That's a great question. Tina is having pain wearing flip-flops. So, and she's wearing 2 inches heels regularly for work. So, nothing. So as I explained in the episode, when you wear heel, 2-inch heel is up to there, you're shortening the Achilles tendon, you are also shortening the calf muscles, you're also putting more stress in the front of the foot on the toes where the toe break is, and also you're stressing the plantar fascia, you're compressing all the toes in the front, you're distributing weight from the back of the heel to the front of the foot, and all these things happening, compressing the nerves as well. When suddenly, when you go from there, when you try to take your foot to flip-flops, which is flatter, which is very similar to your barefoot, and suddenly you are trying to redistribute the weight differently, and sometimes that your tissues may not like it, right? And the calf muscle is working differently, Achilles tendon is working differently, the heel is positioned differently, the weight distribution in the foot is differently. That is why you're having that pain in different soft tissues in your foot. We call that flip-flopitis, right? And Tina, you have flip-flopitis. To avoid that, try not to wear heel during the work, try to wear a minimalist shoe if you can, and then do some of the foot exercises and spend more time barefooted. And I'm sure you will be better. Otherwise, consult your healthcare practitioner, physiotherapist in your community to get better professional advice. And thank you so much, guys. That's your awesome questions, Anu. Thank you for your help.
Thank you.
And my man behind the camera, Alvin, without him, this episode would have not been possible. And for all the audiences who are sending us the constant questions, and this episode is all about feet, how to take care of it. And our next episode for next month, for the month of August, we're going to talk about the hip and pain 101. That is the plan. And thank you for supporting us. If you like this content, what we have, please share it with your friends and family so that they can get benefit out of that as well. And please like and subscribe our YouTube channel and also our Facebook channel separately for Ask Giri, the Physio Show. Have a wonderful day. Bye.